to improve the preventative healthcare aid for New York City's homeless. To start, the prevalence and incidence for homeless in New York City is much higher than that of non-homeless and low-income individuals. Disease spread is much quicker through public transportation and just through population density itself. Common diseases include hepatitis, tuberculosis, the flu, HIV and AIDS, pneumonia, and upper respiratory tract infections. Healthcare costs are typically more high for homeless individuals because they typically seek emergency medicine where they can't be turned down. Attempts at universal health care in the past have been shut down, and there's currently no laws to assist the homeless in their advocacy for preventive medicine. So we're focused on the attainability and practicality in terms of the evaluation criteria for the alternatives. We basically want to make sure that the homeless are actually able to get the care that they need, and that there will be a high turnout, so the utilization of the program is high. The turnout could be low based on things such as the anti-vaccine movement and mental illness causing fear of healthcare practitioners. So some of the alternative methods will be compared to the status quo, which is currently a small number of clinics utilizing donations and only treating a small number of homeless people. So we want to basically increase the locations that homeless people can get vaccinated, screened, and treated for diseases. We also want to increase the homeless population's trust in the treatment and healthcare professionals. And we want universal acceptability for patients coming to physicians for preventive medicine. So we want to start out by contacting people and organizations that are already very close with the homeless community and utilize them to spread awareness of the benefits of preventive medicine. We then want to start using fairs and treatment tents in areas that homeless will be in order for a short-term fix until we can get more healthcare providers and facilities to agree to treat homeless people for government incentives. Lastly, we will analyze the data and see if there are any ways that we can improve the situation and the current policy. So some of the limitations include the anti-vaccine movement and decreased willingness of people to be vaccinated through mental illness, and powerful advocates against this type of movement. So companies that think that they might not be financially beneficial through this policy. So to summarize this, we basically want to spread awareness and create a more equitable system by increasing the access of preventive medicine to homeless and therefore increasing the herd immunity of the population. This will ultimately create a lower cost healthcare system as